Thanks, Dr. Brent. Thanks, Dr. Lador. Rohan, as good as ever. So if the answer to this was no, I just put up one side, say no, and we move on. But I'm going to frame this a little bit about not only what's happening with COVID, but some things that were happening prior to COVID as it relates to supply and demand. Supply and demand both on the employment side, but also with healthcare utilization. I don't have any disclosures. A publication in Surgical Endoscopy in 2017, which was a survey of past Fellowship Council accredited fellows, over 200 fellows. One of the questions they asked them was about job marketability. And over 82% of the fellows said they were able to find a job that was well suited to my personal needs with relative ease, meaning they agreed or strongly agreed with that. So certainly the fellows at the time of this publication felt like their job marketability was strong. They thought barriers that graduates encountered in trying to find a job, and some of these are very tactical, like lack of information to look for a job, no structured application process. But the last two, in terms of no job suited my skill set and training, meaning that they did a fellowship and what they learned from their fellowship didn't apply to finding a job, was only 4.5%, which I think is pretty minimal. No suitable job in graduates' preferred geographic area. So if they had a preference to go someplace from a geographic standpoint, 9% said that that was a barrier, so fairly low. Another study that was just published in the Journal of GI Surgery in 2020 actually surveyed those that are hiring fellows, so surgical practices. And surgical practices said, yes, it's desirable at almost 92% to have a candidate who completed a surgical fellowship training. So both on the trainee side and the trainers and the hiring side, it seems that fellowship does provide benefit. A little bit about supply and demand as it relates to surgical specialty practitioners. So this is data from the U.S. Department of Health and Human Services that was published many years ago that tried to model what was going to be the supply and demand across all providers, but this is specifically about surgeons. And looking at a 12-year period from 2013 to 2025. And if you use general surgery as a marker of fellowship, potentially fellowship-trained surgeons as well as general surgery-trained surgeons, in 2025, there was going to be a greater demand than the supply, almost to 3,000 FTEs. Now, very similar to what the fellows had referred to in that survey, there is a geographical difference of this, meaning that there was a greater demand than supply in the South, so the South would have a greater need for FTEs, and in the Northeast there would actually be an oversupply of surgeons by 2025. So again, it's geographically distributed differently, and I think that just has to do with population growth. So certainly, fellows believe that there's value of fellowship trainees at getting a job. Those hiring trainees desire a fellowship-trained surgeon, and there's certainly a supply and demand mix that is favorable for those finishing training. So then COVID happened, and COVID was very disruptive as it relates to the supply and demand and healthcare utilization, what was happening with the finances within health systems or practices, no matter how you looked at it. So this is updated information looking at, again, the supply and demand, knowing what has happened with COVID and trying to model out how long it would take to recover that, and there's still a big supply and demand imbalance. And in surgery, that imbalance continues almost at the same rate that the previous modeling did. And then they remodeled that, looking at what are some disruptive or evolving care delivery systems. So in surgery, that would be if you have a advanced care provider as part of a team, would that disrupt the number of surgeons that you actually need to care for that patient population? Or if you introduced virtual care. These don't affect surgery as much as they do in some of the non-technical specialties, but again, still a supply-demand mismatch that's very favorable to a trainee who's finishing a program. But then what happened? COVID happened. And this just gives you a sense of some of the articles that were published about COVID. COVID-19 reducing physician compensation, jobs options. New physician compensation recruitment takes a hit. Survey, income dip seen by nearly 75% of doctors due to COVID. And the bottom right hand, 21% of physicians furloughed, had pay cut during COVID-19. So not a very good job market. And then the one in the middle that I think is most apropos for this talk, resident fellows face the prospect of an ugly job market. So they actually, this is a survey of fellows who had finished in 2020, so this is relatively new information, and surveyed them to get input in terms of what actually happened to you finishing your training as a fellow and entering the job market. And these weren't all Fellowship Council trained surgeons, they were fellows from other disciplines as well. But as you can see here, it said that they felt hindered by both the virtual interview format and widespread hiring freeze. And that's certainly something that we've seen in our own health system and seen across the country in terms of more discernment or delay in hiring physicians, both in the technical and non-technical areas. So what other things were happening? And some of these were happening prior to COVID, but may have been accelerated due to the pandemic. The number of solo and small surgery practices were declining before the pandemic. So yeah, Rohan is unique in terms of the type of practice he has. As a result of that, there was some consolidation. So those practices were being consolidated into hospitals or health systems. And when that happens, that leads to efficiencies. And some of those efficiencies mean elimination of positions. The other thing that's been interesting with COVID, no one knows yet how this is going to play out, but there's been almost a geographic redistribution within the U.S. population. The U.S. Postal Service suggested that in the first essentially 6 months of 2020, 16 million Americans moved either temporarily or permanently, and there was a greater distribution of that movement to the south and to the west. There was a larger migration that they've seen in the past from urban to suburban areas. So how could that be disruptive in terms of an acute care facility that's delivering care in a market where either people are actually just leaving the market, going from an urban to a suburban location, or actually just leaving the geographical area? The other is that because of a lot of changes that happen in employment, there's been a disruption in insurance status. That may result in a redistribution of payer mix, and those redistributions of payer mix may have financial consequences as it relates to surgical and non-surgical practices and put some practices potentially into jeopardy. The other is that, and this has been happening for a long time now, and that is pre-COVID value-based managed care contracts and then the new multidisciplinary care models, there was projected decreased utilization of care, not only in surgery, and that was projected to be about 3%, but inpatient utilization and ED utilization. With COVID, and if you look at this curve, this is non-COVID admissions. Looking at what happened in the March-April time period, there was a rebound after the first surge of the pandemic. But those inpatient admissions never rebounded to a baseline of 2019. And in fact, in November, December this year, they're starting to see a dip in inpatient admissions. So do we actually have a demand issue, meaning patients demanding care? This graph on the left-hand side gives you an idea of the COVID-19 recession, if you want to call that a recession, versus some other recessions that many of us have lived through or remember, especially the 2007. And you can see how dramatic the change was in payroll job losses from the COVID-19 recession. And again, that has a major effect as it relates to any industry that is based on revenues from consumption. So if I go back to the survey that I introduced at the very beginning that was published in Surgical Endoscopy, why would there be barriers right now for fellows, that a fellow in training to seek employment? And I think this was brought up by one of the previous speakers, is that the fellows gave cues in the survey of, how did they seek employment? Well, it was networking opportunities. visiting professors who came to their institutions, attending scientific conferences, presenting research, so going to another meeting, attending courses, fellowship conferences, et cetera. And all those things were put on hold for a period of time and quite frankly are still on hold except for a very few conferences. Most of them are virtual. So those opportunities to network, to meet potential employers has certainly been a barrier, and that may continue into next year. This is really the summary slide. I think this is, and it's quite intuitive, I think, but Merritt Hawkins, which is a large consulting firm that for physician employment, put out a paper earlier this year, and I'll just read their quote in here, and I think this is the situation that current fellows are in right now. As a result of the 2020 coronavirus pandemic, the market for physicians has flipped from a buyer's market in which physicians had multiple practice opportunities from which to choose to a seller's market in which physicians may have to compete for job openings. I think this becomes highly, highly critical for fellowship directors and those that participate in fellowship programs to help their trainees and be an advocate and sponsor for them, because there may be fewer competitive jobs available than there has been in the past. But it's not all doom and gloom. The three sentences up top just give a little bit about some of the things that happened with the pandemic that I've already covered around finances. But a general surgeon actually has a lot of leverage and a lot of power. If you look at the contribution margin to a hospital based on your subspecialty, general surgeons rank number 4 behind orthopedic surgery, invasive cardiology, and neurosurgery. So I think as the economy recovers, the demand starts to increase again, and hospitals or health systems or medical groups or even private practice physicians are willing to take more risk from hiring general surgeons, certainly have a lot of leverage in that market. Thank you very much.